I'm April, this is Kaitlin, my patient, and Matt's over there on the camera. Today we are going to be talking about a home assessment for a patient with a left total hip replacement with a rolling walker, and she's weight bearing as tolerated. So what we're first going to talk about is the precautions. There's two areas that we have to cover here because there's an anterior lateral approach that the doctor's going to do, and there's also a posterior lateral. So we'll first start out with the anterior lateral approach. These are precautions, so we don't want to see this with our patients. The first one is no hip extension. So this is her left leg.
Ouch.
We don't want to see this at all. We don't want to see any lateral rotation.
Ouch.
Yeah. And no adduction of that hip.
Ouch.
Go. Yeah. And then she's going to have a seat. And the most important thing we don't want to see with our patients is their knees going below 90 degrees. So right here we have,
Ouch.
we have her with a nice supported blanket, or you could put a pillow to keep her above 90 degrees. And then a little backrest to kind of support her. And that's with the anterior lateral view approach, and then we're going to go to the posterior lateral, which is very similar. The only difference is we don't want to see any medial rotation. So we'll show that any
Ouch.
going inward with the hip, and then we don't again want to see any hip flexion or adduction with the hip.
Ouch.
And those are the precautions. Now we're going to start our presentation. We're going to show the entrance of the house first. We're going to be going into the living room, then we'll go to the kitchen and eating area, and then the bedroom and bathroom.
Okay, so to get started, we're going to be talking about the entrance into the home. First off, if you have two different entrances, you want to make sure you choose the entrance that is most accessible, and that's the easiest to get into. We have the garage entrance, but we're choosing to use the outside front entrance to the home because it's the easiest one to get into. So first off, April's going to be the patient, and we want to mention too that it's a left hip replacement. So she's weight bearing as tolerated, but she's in the walker. So at first we want to make sure that the surface she's going to be approaching to get into the home is a level surface. You don't want any cracks or huge bumps in the pavement because it can cause her to fall or trip, and we don't want that. And then as we keep going along, we want to make sure that the surface is wide enough. At least 32 to 34 inches because that's the average width of a walker or a wheelchair. So that's very important because you want to be able to maneuver into your home. Next we see there's some potted plants on the side. You want to make sure you watch out for any obstructions that could be in the pathway leading into your home. Oh, careful, careful. So we would get those out of the way. And then coming up are two stairs, and you want to make sure you know the number of stairs that are going to be in a patient's home so that you can practice that before they leave the hospital. So that's why we're doing part of this assessment. So two stairs, they're in good condition, there's not any cracks, they're pretty level height, and she wouldn't have any difficulty ambulating up them or getting up them. So first we're going to have her put the walker up first, followed by the good leg, and then the bad leg. Good, and then get nice and close. Put the walker up first. Good leg, bad leg. Perfect. And then also we want to make sure that this potted plant over here too is probably out of the way so that she doesn't bump into it or trip and fall or anything like that. So now we're kind of in the main entryway. It's awesome because it has a cover from the weather. So if she's coming in from the outside, she can stop here for a second, catch her breath before she enters into the main home. We also want to make sure that during weather conditions the sidewalk isn't icy. Obviously it's sunny outside, so we don't have to worry about that, but just make sure there's no slippery areas. For the stairs, if April was having trouble seeing, we could put some bright tape on it so that she could tell the difference between the two stairs and the level surface. We see that there's a mat on the ground. It's pretty easy to remove the mat, so we could do that. It's a little bit bumpy too, so just another thing for her that could get in the way. The wide doorway, we've measured this. I can show you too, that It is wide enough. It's about 35 inches, and your average is 32 to 34. So that's good. We know that the walker will fit through there, so we don't have to worry about that. One thing is if you have a screen door on the front, you want to make sure that you open it first, and there's a locking mechanism on the bottom. Lock it and have that open before you even get to that big door in the inside. That'll help you plan ahead of time and have the access into the house a little bit easier. Also, we have a big lamp up there that they can have on at night to light the walkway so that they don't have any trouble walking through or tripping on anything. One last thing before we actually get inside the house is the raised threshold. So it's actually just another step to get back into the house. But there's a little bit of a piece, I don't know if you can see it, we can show it on the inside too. On the inside that's a little bit of a bump up. So we can add a little bit of a threshold ramp to make it a little bit easier to roll over the top with the walker. And that's it. Now we're going to head inside and talk about a little bit more inside. Okay, so now we're inside the house. We had April come inside, and one of the first things you notice is there's some lovely little puppies running around. And you want to make sure that when you're first coming into the house that they're either, outside or a little bit out of the way because you don't want to bump into them, or, that could be a tripping hazard too, and we don't want to injure the dog either, or have them run outside. So make sure that they're kind of out of the way. Another thing we saw when we first entered the home was this carpet rug here. We could add grippers to the bottom to make sure that she doesn't slip or slide on it, but for the sake of it, for now, we can just move it out of the way. Then as we're coming up to the door, if she was opening the door on her own, we want to make sure that it's not a heavy door. We want to have at least less than 8 pounds of pressure to open the door, and this one is pretty light, so it's perfect. The handrails, we want to make sure that they're not slippery. Sometimes there's a knob handrail. This one's actually like a gripper kind of handrail, which is perfect. And we could adjust for that if we needed to. There's also a lock on it, but if you're going to be coming inside with a caregiver or something, they'll open the screen door and they'll unlock this part for you, and usually have it out of the way so that you don't have to worry about it. So now April's going to show us, we're going to head into the main living area of the house. So April's coming up to this first doorway. It's perfect, it's wide, it's open. And then she's going to head into the TV room area. You want to make sure that you watch out for this carpet hardwood floor transition because you don't want it to be too rough. She might have trouble tripping, or just make sure that there's a level surface. You can add a ramp to that too if you need to. So watch out as you're coming through this area. We're transitioning into the carpet, so it's going to be a little bit more difficult to ambulate, but just be aware of that. You want to make sure that she has good shoes on so that she doesn't slip or fall. One thing that she just passed through was the ottoman. We kind of moved that out of the way because you want to have enough room between the furniture so that you can get the walker in and you can move safely. So then the next thing, we kind of showed this in the beginning of the movie, but you want to make sure that she doesn't go beyond 90 degrees of flexion when she's sitting or when she's moving. So we're going to have her sit down, and we have 2 pillows supporting her so that she's in the correct position and alignment for posture and for her precautions. One of the major things too you want to make sure with your furniture is that it's not too soft or too firm. You want to give her the perfect amount of support. Then next to her we have her TV remote, the phone that she might need, computers, or anything that she might need in case of emergency, so that it's near her and she doesn't have to get up or move around a lot. So then I also want to point out that there's good lighting in here. The light switches are located right where we entered through, so if she wanted to turn on the lights, she definitely could, and that would be accessible to her. So next we're going to head into the kitchen area, and Matt's going to show us a little bit more about that.
Okay, hi, we're here in the kitchen, and April is our patient again. So if you look around, you can see it's a pretty modern kitchen, so there's not a lot of things that we have to do especially for a hip replacement, because it's only really a temporary position for the person. So the first thing we're going to do is we're going to look at the flooring. We have solid, even flooring, and it's real nice. It doesn't, we don't have to worry too much about slipping and sliding, so it's good. Our next thing you can see is we have a nice wide pathway, so she should be able to walk right through there. And the other thing, the refrigerator is a nice side by side, and it's got some drawers for underneath it that are really nice. She can also add a basket or a tray to the front of her walker. That way she can, if she takes stuff out of the refrigerator, she can put it in a basket and take it over to the dining room table or to this island or to the countertop, just to make preparing food a little bit easier for her. So now we're going to come a little bit forward. You can see a nice, really nice countertop here. One thing you can do is if the microwave that is here, if it's too high, you can always get a countertop microwave to put on here. It might be a little bit easier for her. The other thing, you want to make sure any items that she uses regularly in the kitchen, that we're at a nice height for her so she's not overreaching or bending down too much. In lower cabinets or even uppers, you can put like Lazy Susans in just to help, just for access to everything. As you can come through here, it's another nice, real wide walkway. She has plenty of counter space to do whatever she wants. She can get to the coffee maker, she can prepare food, she can do all that really well. As we come through here, the only thing I see here is there's a garbage can here. We might just want to slide this out of the way just to give her a little bit more room and access. And then as she's going to come through, she's going to leave the kitchen area and come through the dining room. As we come this way, you can see that there is a throw rug by the patio. You can make sure it's a non-skid pad, or even else we could just pick it up and remove it. And then as April comes around this way, the only other option, the other thing I see here, there's an obstacle, which is a dog bowl or dog dishes. We just want to make sure that it's out of the way so she doesn't hit it, and make sure that if it is a water bowl, that the dog doesn't, sometimes the water can get all over, so we don't want him slipping and falling. It could get a little slick there. So now April's going to come around here. There's just a little transition from carpet to hardwood. Again, we just want to make sure the carpet's nice and secured down. And then we're going to come over to the dining room table, and we want to make sure that we have nice sturdy chairs for her to sit on, and we also have it padded to avoid that 90-degree of hip flexion, so when she sits. Okay, now we're going to go back to Kaitlin, we're going to work on going up the stairs.
So now we're going to be talking about how to get up the stairs. First off, we want to notice that there's some handrails, which are wonderful. They're at the perfect height. So April, instead of using the walker, we're going to be using the handrails to get up the stairs, because the walker will not fit up the width of the stairs. The width of the stairs, it's pretty good, probably larger than most because it's a modern home. So that's great. You can get enough steppage in there for Kate. And then we also want to make sure that they're level and even, so that there's no uneven stairs, because it might be a little bit harder to walk on that. Especially with the carpet, it would be better if it was all hardwood floor, but that's okay. We've got good shoes on, and we'll make it up there. So another thing that we want to point out is that it would be very helpful to have the walker on both levels of the house. So we can have the one here on this level, and then either you can have the caregiver bring the same walker up the stairs so that it's ready for her when she finishes walking up the stairs, or you can have 2 sets available. And so then April, the first thing we're going to do is bring the walker up there, and then we're going to go through going up the stairs, okay? So now we're going to be talking about going up the stairs. Move a little chipper out of the way. So what we want to focus on is the handrails. Normally, because she has a left hip replacement, which is the blue wrap, we would have her come up on the left side because that's where the affected leg is, so that she can pull her support through this handrail. But this left handrail does not continue all the way up the staircase. So we're going to have her go with the right, and then she's going to go up with the good leg, and then she's going to go push through the handrail with the affected leg. Good. Perfect. Nice job. One more stair, April, and then we're going to head into the bedroom bathroom. Okay, so now we're at the top of the stairs, and we're going to be heading into the bedroom bathroom area. One thing we want to notice is at the top of the stairs we had the walker set up for her, which was great. So that was a good transition, but then there's some dog bed and dog toys. So we just want to make sure that they're out of the way and kind of put to the side. And we're going to head into the bedroom, which is this way. And this is great. There's 2 wide doors, plenty of space to enter into the bedroom, so we're being safe and it's accessible. Perfect. So now we're going to enter into the bedroom, and April's going to tell you a little bit more about that.
Alright, now we're in the bedroom area, and the first thing I want to kind of check is the walkway. The walkway is wide open, we have nothing in the way, and then we're going to go over to the windows. I want to make sure all the windows are locked, and the caregiver can make sure this is all done if it's an older patient. With these windows, there's a very easy switch to kind of close them and open them, so that's no big deal. And then for this patient, we have a left hip replacement. So we always want to go to the side of the bed that's on the uninvolved side. So we'll be on the right side. So we always want to have an extra pillow available. So this is my extra pillow for the patient. It will always be here for her whole time for the precautions. We don't want any adduction, so this is going to go between the legs when she's sleeping. So this can lay on the bed when she's ready. It can stay on the floor just so it's easy access for her. And then next to the bedstand, we always want to have a phone available with a charger. We want to have an emergency contact list. The most important numbers you can have here, so if she gets flustered, she has the phone and contact list. Her medicines are very important, so we have that here. And then also just a little flashlight if needed, definitely for an older patient. And then I'm always going to have a nightlight for her. For any patient, just so we have a nice light if she needs to get up in the middle of the night. So now our patient's going to come in, and for the bed, we want a nice firm bed, and we don't want anything low. So if this is a low bed, that's an issue, because to get in, she has to kind of sit down. So if you want to show us how, it's probably the perfect height for you. Good, nice firm, not too soft. Not too hard. This is the perfect height for her. And then at night, she's going to just kind of keep her walker right here so it's at her arm's reach when she's ready to get up and get started for the day. So now we're going to come in to the bathroom area. Get everything. Alright. This is perfect because we have a wide door. But if for some reason they were a bit smaller, she'd probably have to sidestep into the bathroom, which is just fine with the walker. We'll head on over to the sink area, and the only issue I really see is, first off, the rugs. So I would probably remove these or put a non-stick grip on them. So for this case, I'm just going to remove it just to be more safe. This also is not a slick surface, but it's more slick than the carpet, obviously. So we're just going to be cautious about that. I'm going to tell the patient to slide up next to the countertop as close as possible because we don't want a lot of bending or reaching to get into that flexion. And then she does her business over here. And then we're going to move on over to the restroom area. So again, walkway is nice and clear. Nothing in way except a doggy. So, as stated before, these doors are not wide enough for this walker. They have to be 32 to 34 inches, and my door is only, well, if we go on the inside of the molding to the other side, it's about 28 inches. So that's going to be an issue where we have to tell the patient to sidestep within the bathroom. So I want the patient to kind of sidestep and show you how that's going to work. And then when we get into the bathroom, the most important thing for our precautions is to keep the walkway clear, but also on the 90-degree hip flexion. So I'm going to provide her with a raised toilet seat. So when she's all done with the surgery and all the stuff with the hip, she can just remove it. So it's just raised above 90 degrees. I'm going to have a grab bar on the left side, or the right side of her, and also on the left side, just for safety, especially if it's an older patient. If not, she has her walker there, she can push it forward. two major concerns right now is this dog. Should never be in the bathroom with you. And then this toilet paper holder we would put off to the side, just so she can scoot the walker out of the way. Alright, so we're finished with the bathroom. She's going to sidestep out, and then we're going to go straight to the shower. The shower area is pretty important as well. I know we talked about rugs, but I really want to keep this rug here because it's non-skid, and then when she gets out of the shower, we don't want any slipping. The shower is pretty wide, so she's going to bring her walker all the way up. And what I did was highlight this step because this step is pretty big, and she could easily forget it's there because she's so worried about her hip. So I highlighted that with a big bold color. And then she's going to go in. I have a chair available. Most likely they'll probably want the chair. It's above 90 degrees, so she can sit in there. I also have, it's well lit, as you can see. But I also have a non-stick mat with suction cups in the shower. And this chair is also non-stick. Her shampoo and conditioner is at arm reach. There's a grab bar if needed. And I provided a long brush so she can brush, or so she can clean her legs and stuff like that without doing too much flexion. We don't want any flexion. Also, there are removable shower heads. So if the patient cannot stand, but she's weight bearing is tolerated, but let's say they're an 80-year-old and they don't have any endurance, they can take that head of that shower head and clean themselves while sitting. And just be careful coming back out. She has her walker right here, and this mat is just to provide her stability when getting out while wet. Towels are also available right here, and they should always be. So now she's gonna get dressed, go into her closet. So she's gonna come in here. Again, these doors are a bit smaller, so she's gonna have to sidestep like she did before. And then just the most important thing is having clothes at arm's reach. She's weight bearing is tolerated, so she's not going to have an issue with this height. She can also have clothes out and ready if she wants. The caregiver can on this table. The table's always nice. And the most important thing in this area that I see is this cord. So I would definitely unplug this cord and get it out of the way. And then she's a very vain person, so she would just open this for a little bit of natural light to put on her makeup instead of having this plugged in. There's solutions to everything, so that is our video of a total hip replacement.